Maybe a good chance to dovetail in the idea of metabolic syndrome. So can you describe what is the metabolic syndrome?
Well, functionally, the metabolic syndrome I would describe as a bit of a red flag that you are on a path to developing diabetes and perhaps heart disease. And another way to say that is it's a sign that if you have a diagnosis of metabolic syndrome, that your body is struggling metabolizing the carbohydrate load that you're currently taking in. So it's an early sign or a harbinger of a unhealthy path, or a road that you're going down, and that road involves carbohydrate intolerance, that you're on a path to developing more severe forms of that. So we found that metabolic syndrome is very responsive to carbohydrate restriction. And metabolic syndrome is a term that has been more recently used. It's also been called insulin resistance syndrome or syndrome X, and it involves a cluster of different risk factors that maybe on the surface seem unrelated, but I think most experts would agree that there is a sort of common thread that does link these markers, and that thread is probably insulin resistance. And so it may not be surprising, since we define insulin resistance as a form of carbohydrate intolerance, that all these markers tend to get better when we restrict carbohydrates. And we have quite a bit of evidence to support that statement.